think that should be good enough. All right. We're just gonna let that be there, and then she's just gonna watch it and grade me on all the things.
Of course.
All right. So have you ever had physical therapy before?
Yes.
You were with
I
Dr.
was here
Hillary, right?
like a few months ago, like 3 months ago, I think.
Okay, perfect. So today's evaluation, so we're gonna chat a little bit, find out what all's going on specifically. I'll run through your medical screen with you, see if anything's changed since you were here last, and then we'll do an assessment and see how things are feeling, okay?
Okay, did the VA specifically say why I'm back here?
I believe it was back? Is it back or is it
No.
knee?
It has to be knee.
It's knee, okay.
It's knee, and then I'll be after the knee. I'm gonna ask for another one.
Okay.
It's for my sciatica
Okay,
here. Yeah,
okay. But the one for today is supposed to be for the knee?
yeah. For this, or is it 10 sessions you guys give?
It's usually 15.
Oh, 15.
15
What was
with
it
a VA.
last time? I felt like 10.
They usually do an updated note at 10. I think what it is, they pay for an eval, a re-eval, and then what is that, 13 other sessions. So it comes out to 15 total, but including the eval in the progress note. So
Alright, cool.
I'll double check what it is.
That's all right.
We'll chat about the knee and the back too, because the upside of it is we can treat both, because the correlation of where the body parts are.
Oh, okay.
Okay. So more bothersome right now is the knee.
No.
No.
Actually, the pain went away. I waited 3 months because the
Okay.
VA is slow.
Right.
By the time you put in, even though they say, oh yeah, by next week you can, yeah, BS.
Oh
Bullshit.
no, right?
3 months later, because see what happens with the VA when I call to make the appointment
Mhm.
to say, okay, I need physical therapy now
Yeah.
for the knee. Okay, they're like, okay, well the next appointment is blah 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 for the
Perfect.
VA. I'm like, no, that's too long.
Right.
The first they want you to go to them. They're not gonna
Oh, right.
And then once there's no appointment with them at
Right.
the VA hospital at Audie Murphy,
Mhm.
okay, then they're like, okay, now we can outsource you.
Gotcha.
So the outsourcing is what takes 2 to 3 months.
Okay, I got
Yeah.
you. Okay. Well, I'm glad we made it back. I know
Oh wait, so they outsourced me to not shirts, Converse physical therapy. I'm like, no, I live in Live Oak. Can you put me back where I was? And that took another month. By the
Oh
time
my
they
Goodness. If they just listened the first time, right?
yeah.
All right. So tell me, is the back the more problemsome area?
Okay, well, yes.
Okay.
Well, it's not the back, it's sciatica right here. But
the
of
left
course
side
it
of the
comes-
leg?
Yeah, I know
Okay.
it comes from the back, but it's the sciatica.
Okay.
And this never goes away. It's always like tingles. I have tingles
Okay.
forever.
When did that start?
I had physical therapy the first time when we were stationed in the Netherlands
Okay.
at Volkel Air Base. God, how many years ago? Shoot, I don't know, maybe 15.
About 15. Okay.
15, about 15 or maybe 17 years ago.
Okay.
Or 15, I don't know.
And was there anything specific that happened?
Yes.
Okay.
Oh, no. How they treated the sciatica? That's what you mean?
No, like did you have a fall, an injury, or just
No.
kind of progressively
Just
showed up
started
one
to-
day?
Yeah, it just
Okay.
showed up one day. Yeah.
Okay. Any pain down the leg, or is it just numbness?
No. So how it is normally it's numb. But
Okay.
then sometimes, now, I'm not talking about back at 15.
Mhm.
Now sometimes any burns,
Okay.
okay, and then you have the tingle effect and the sharp pain.
Like stabbing almost.
Yes, that exactly.
Okay.
And then back to numbness.
Okay.
And then it just
And it
switches.
comes around to the front of the leg, like
It's
the
here,
side to
yeah.
the front.
It's
Okay.
it's the whole here, like the side to the front.
Okay.
Yeah.
Gotcha.
It's been like this for a long time.
Okay. And then the burning and sharpness is more recent.
No, it's always like that.
It's always like that.
Yeah.
Okay. Gotcha. If 0 is no pain and 10's the worst imaginable, what's the worst it's been in the last 2 weeks?
For this, we're not talking about the knee. It's
Correct,
For this.
for
Okay. But the thing is, we all get used to it.
Mm-hmm.
You know, especially women.
Yeah.
So I don't know what to tell you. I
Okay.
mean, I'm so used
You
to
just
it.
deal with it.
I just deal with it. It's
Okay.
like I don't take anything for it. Why would I?
Is there? Do you have moments without pain or moments that
No.
you don't notice it?
No, the only without pain is when it's tingling.
Okay. But it's always
The numbness. Yeah, it's numb. It's like, yeah.
Okay.
numb.
Gotcha.
It's like, whose leg is this sometimes? You know, like,
Right.
yeah. See, now I'm going like this, now it's like hurts, like
Okay.
sharp pain.
Going through it. Okay.
Yeah.
Is there anything you've noticed that makes it worse?
Probably sitting too much,
How long is too much? Like an hour, 10 minutes,
like an hour.
an hour? Okay. What about when you're standing or walking? Any problems with that?
No, but it's still the same thing.
You still just feel it, but it's just worse when you're sitting.
I can't say that. No,
Okay.
it's pretty much the same.
Okay.
Pretty much the same.
Is there anything that you found has made it better?
No.
Okay.
Nothing. Yes, I did.
Okay.
Okay, but I can't do it myself.
Okay.
It's what the guy did in the Netherlands 20 years ago. He
Mhm.
made me lean down, but now I'm fat. I can't do it, but then I was skinny.
Okay.
You know, like all the way down, like touching the floor. And then what he did, he looked at over here on my spine.
Uh-huh.
And he says, okay, it's not straight. Let me align it for you.
Okay.
Yeah, so then he made me lay down on a hot something for my back,
Mhm.
and then he cracked it for me the right
Okay.
way, and then he aligned it.
Okay,
And once
and-
it was aligned,
It used to.
everything went away.
Okay. Gotcha.
So it's the alignment in my spine, I guess.
Gotcha. Okay.
The lower back, or whatever you want to call it.
Okay. Do you have low back pain?
Oh, yeah.
Okay. And is that more of like an achy dullness? Is that
It's like depends what I do.
okay?
Like if I'm washing the dishes and I'm forward too much,
Mm-hmm.
then yes, then I have to like spread my legs,
Okay.
you know, and then, okay, now I can wash the dishes spread. You know,
Gotcha.
I can't lean forward too much because then it hurts.
It hurts. Okay.
Yeah, the lower back.
What about like walking, standing for the low back? Any?
Oh, yeah.
Okay.
Yeah, when I used to be a bank guard,
Okay.
oh my God. Yeah, that hurts standing too much on my lower back.
How long is too much before you start to feel it? An hour?
Yeah,
About? Okay.
an hour or two.
Okay. And then things that make it better when you stand a little bit wider,
Or lay down.
or lay down. Okay, gotcha. Alright. And then do you find that if the back is hurting more, the leg hurts more, or if the leg hurts more, does the back hurt more? Do they kind of feed into each other that you've noticed, or not specifically?
Okay, with this leg, it always hurts. So
Okay.
there's no, like,
There's no like relief of it?
No, there's no
Okay.
relief since we left 20 years ago from the Netherlands.
Okay, gotcha. Okay.
Yeah.
And then, alright, so back,
The back,
left leg, and then right knee?
yes, the
Okay.
right knee. I had MRI like years ago with the VA,
Okay,
and they found some tear.
okay,
So they gave me a shot, like this huge needle,
like a cortisone or something?
Yeah.
Okay,
and it went away.
okay,
And they told me you're gonna be back in 3 months. I didn't come back for 3 years. It was good for 3 days. They're like, we never seen anything like this. It didn't work for 3 years. So,
okay, good.
yeah, but then it started hurting again. Is when I kneeled down and went like that one time, and
Mhm.
maybe it was too fast or I don't know what.
Okay,
And then that's when it started to hurt again.
okay, and that was recently?
Yeah, like 6 months ago.
Okay,
Yeah. I kneel down to get the dog food.
okay, and it's more on the inside of the knee?
It's here.
Okay.
Yeah. I'm not gonna say it went away completely because if I walk,
Mm-hmm.
then I feel it, then it
It
hurts.
talks to you again.
Yeah, it's exactly. It's
Okay.
like, oh shoot, I have a knee.
Okay,
Because you know when you don't feel anything like
right, you just kind of get used
Yeah.
to it. Yeah, I get you. Okay. Any problems going up and down stairs, curbs?
I don't have stairs.
Okay.
I don't know.
Okay.
I don't walk on stairs. I don't.
Any problem like bending down, picking things up?
Yes, I feel it.
Okay.
Yeah, but it doesn't hurt the way it did 6 months ago.
Okay. So it's improved, but it's still
yes,
there.
it's improved, but it's still there.
Okay,
There
gotcha.
you go.
Anything into the left knee?
No.
Okay. Anything into either your feet at all? Feet are okay?
Oh, yeah, that's normal.
Okay. That's what you were here for before?
Exactly.
Okay.
Yeah. So for the feet, it goes and comes and goes.
Okay, gotcha.
Yes.
And is it both feet?
Yes.
Okay. And is it like arthritic changes or did you have
I think so. Yeah, the
Okay.
weather has a lot to do with it.
Okay, gotcha. Anything into the abdomen or chest?
Yeah, the chest. What do you mean by chest?
Chest pain, shortness of breath, anything
Oh,
like
I have
that?
asthma, so that's normal.
Okay, chest pain with
Yes.
the asthma, or
Yes.
chest pain outside of like asthma?
Like when I have allergies, then chest pain.
Okay,
Yes.
gotcha.
And then triggers the asthma, and it's the whole thing.
Gotcha. Okay, and is that managed with like inhaler or
Yes.
medication? Okay, good. Anything into the upper back, shoulders, elbows, hands,
The hands, yes, I had the
carpal tunnel?
carpal tunnel with
Okay.
both of my thumbs. I couldn't use it for like 3 months,
Okay,
but then it went away.
okay.
Yeah, the
good.
doctor said, go and let's do an operation. My mom's like, no, don't do it. It's gonna go away.
Well, there you
Sure
go.
enough, went away.
Good. And then head and neck, doing okay in that region?
Yeah, I mean,
Okay.
yeah, it's for now, yeah.
Okay, good. Any falls or anything like that? No. Okay, good. Alrighty. Any change in bowel and bladder? Any incontinence, urinary incontinence, anything of that nature?
I do pee a lot.
Okay, like a frequency more than anything?
To just the frequency, yeah.
Okay. Any pelvic pain, history of pain with anything there? Okay. Okay.
No, actually, there was one time.
Okay.
But that was a long time ago. There's no reason to talk about it yet.
Okay, fair. All right. As far as goals for therapy, what would you say they are in your words?
My goals
Mm-hmm.
okay, now we're changing the knee then, right? Or we doing both?
So I have both on here. I'll double check what the referral says.
Yeah.
And then we'll kind of plan from there moving
Okay,
forward.
sure.
I'll assess everything today, so I'm going to do a full
Of
lower
course,
quarter
of
screen. So I'm going to include both in it.
Good.
And then hopefully you get relief of both at the same, and you don't have to wait for the second
Well,
referral if you don't want to.
I know, but the thing is, I remember, I'm just telling you what the VA said, that they don't
Okay.
do both. They only do one at a time. I asked,
Gotcha.
can I do both? And,
Right.
they're like, no.
You have to
one
pick
thing
one.
at a time.
Okay,
So that's why I
gotcha.
picked the knees, because that's when it was hurting. But
Okay.
now.
And now it's more back. I get you.
Oh my goodness.
Alrighty.
So whatever. I don't
Whatever it says, we'll figure it out.
Yeah.
Okay. So as far as goals
Goal?
for
I want it
back
to go
on-
away. I want the pain
Okay.
to go away. That's
Okay.
my goal.
All
What
right.
other goals are there?
All right. And does that look like being able to walk, stand, do your job without any issues? Okay.
Oh, but wait. No, when I had the knee problem, I was limping.
Okay.
It was 6 months ago.
Okay.
I was limping. It was that bad.
Gotcha. But not
But
really
not
limping.
now.
Okay.
Not now.
Okay. Well, we'll see. Alrighty. I'm gonna run through your medical screen with you real quick.
Sure.
And then after that, we'll take a peek at everything, see how you're moving and grooving, and go from there, okay? Alrighty. Past surgical history, breast implant?
Yeah, that was a long time.
Okay.
Like 20 years ago, 21.
Okay. And then nothing recently?
Nope.
Okay. Medications, loratadine is what?
Loratadine, yeah, loratadine, yeah.
Mhm.
Yeah, that's for allergies.
Okay. And then the paroxetine?
That's for anxiety.
Anxiety. Okay, gotcha. Alright. And then you had an MRI, but that was a few years ago, or did you have
Yeah,
one
a few
recently?
years ago. Yeah, that
Okay.
was a few years ago.
Gotcha. Okay. Alright. I'm gonna run through this list with you. It looks like you already ran through it. No history of cancer or diabetes,
No.
stroke, blood clot.
Well, my doc's saying that I need to get off sugar because of, I'm pre-diabetic right now, but I'm not
Okay.
diabetic.
Gotcha.
It's asking if that I'm not. It says pre.
Okay, gotcha. When was your most recent A1C or blood work?
Let's see. 2 weeks ago.
2 weeks ago. Okay. Alright, and they're monitoring everything.
No, because right now we're focusing on my allergies.
Okay,
And
trying to
if
get
it
those
takes step
managed.
by- Yeah, because this is the worst.
Okay.
The allergy, yeah, it's bad.
Okay. Yeah, Texas does that. I'm from Florida, so I'm like,
Yeah, but
what?
it's food. I'm talking about food.
Oh,
Yeah,
gotcha.
we don't
Okay.
know what it is. So
Oh.
they're trying to figure out.
Okay.
And because it's such an emergency, it's still been 3 weeks and nothing.
Okay.
They're gonna do skin scrape for allergy testing.
Just to kind of see what's going on.
Yeah, they're gonna scrape your skin.
All that good stuff. Okay. Any history of pacemaker or depression?
Depression? Yeah, when I was
Okay.
younger.
Okay. Managed now though?
Oh my god, yeah.
Okay, gotcha. Ulcers?
Well, acid. I have lots of acid, but
Okay.
not all the time.
Okay.
You know.
Alrighty. And then anything with heart, liver, kidney, or lung disease aside from the asthma?
No.
Okay, good. And then the osteoarthritis that in the feet.
Yeah, it's up here.
Okay.
They diagnosed me. I don't know. It's up here. Yeah.
Okay. Both feet. Gotcha. Okay.
No, oh, I forgot. Neuroleptic. Whatever it was.
Like neuropathy.
There we go.
Gotcha. Okay.
Yeah, that's osteo.
Arthritis.
Yes.
Yeah. Okay. Gotcha. And then so some neuropathy. Okay. And then
Do you know where it comes from?
the neuropathy.
Yeah.
So it can come from a couple different things. Sometimes it can be more vascular related.
You
There's
mean heart?
so like blood flow related or blood flow restriction. There's diabetic neuropathy, so it can come from the
Sugar. What you eat?
the sugar and everything like that. And basically you're just not getting enough blood flow to the area, and that's what can cause that pins and needles and things like that. And then you can also have just some decreased myelination of the nerve essentially. So the nerve isn't moving as well. So whether it's coming from up the chain or it's just been progressed over time, that can also be part of it too.
Okay. Thank you.
But there's a few different kinds.
How come they didn't tell me that? They just said neuropathy. That's it.
I feel like sometimes doctors do a good job of giving you a diagnosis, getting you in and out, but they don't sit face to face, one-on-one with you all the time.
No, they don't.
So I feel like we at least get to see you for a full hour each time that you're here. So if you have questions, we're here to answer them and things like that. But yeah, sometimes it's just like, here you go, and they're just on to the next person.
I know.
But it depends on who you go to. Some are like really good and they'll take like 40 minutes, and some are like in and out, and you're like, okay. If you had a question you forgot, good luck. All right.
Exactly.
I'm gonna run through one more list. It looks like you did this, and then the chest pain you said was just from the asthma.
Yeah, asthma and the allergies. Yeah.
Okay. And then similar with the shortness of breath.
It's the same. Yeah, it all ties in together. Yeah.
Okay, gotcha. Alrighty. Well, let's see how you're moving. We're gonna do a few different things standing first, and then we'll run through some seated screening and see how you're moving
Oh,
from
here in
there.
this room?
Yep.
Oh, okay.
Yep.
Then why
Yep.
not?
Yeah, you can keep everything right there.
Okay.
We're just gonna hang out here. Alright. Let me have you go ahead and stand up for me. First, I'm gonna have you. Can you come up on your toes and take 4 steps forward on your toes? Good. Any pain in the knee, back, anything there?
Not right now.
Okay. And then next, you can come stand here. I'm gonna have you come back on your heels and take 4 steps backwards if you can.
Oh.
Good. Any problem there? Okay. Perfect. Next, let me have you stand on one leg. Good. Any pain on that side, or it's okay?
No, it's okay.
Okay. And then your right side.
Oh, wait, this one.
No, no,
Oh,
the
this
other
one?
one. Yeah.
Okay.
A little bit easier on that side. Okay.
Yeah,
Gotcha.
easier.
Bring your feet a little more than hip width apart and show me what a squat looks like. Good. Come back up. Any pain in the knee, back, anything there?
Yeah, here.
On the inside
Yeah,
of that knee.
see? When I'm,
Okay.
this is like forcing it, yeah.
Okay. All right. Next, what I'm gonna have you do, bring your feet on either side of my foot. So bring your feet together. Good. And then next to my foot. There you go. Perfect. Now I'm gonna have you reach forward towards your toes. Good. And come back up. Any pain or discomfort there?
No, it's just the stomach doesn't let me do a lot of things.
Okay. Hands are gonna be on your hips. I'm gonna have you bend back for me.
Can I open my legs to do that or no?
Try it here and see how it feels. And do you usually need to stand a little bit wider?
Oh, yeah.
Okay, got you. Go ahead and stand up there,
Oh, okay, sorry.
and you can come out of that. I'm just gonna grab a tool real quick, and I'm gonna take some measurements of your back.
Sure.
So I'm gonna grab on either side of the waist here. Just gonna put this here, and then go ahead and reach back down towards your toes again for me. Good, and then come back up. Good, and then bend back here. Good, and come back up. Pain when you go back?
It's the knee.
It's the knee when you go back. Okay.
And the back.
In the back too?
Yes.
Okay.
The
Alrighty.
lower back.
Hands are gonna be at your waist. Gonna have you lean to one side. Good, then the other side. Any problem with that? Cross your arms over here. I want you to rotate side to side. And then the other direction. Any problem there?
Yeah.
On that right side?
Yeah.
Okay. In the low back?
Yeah.
Okay. So what I'm going to do next is I'm going to apply overpressure in all those areas. So I'm going to take you through them again. If anything changes, whether it improves it or
Okay.
increases it,
Say
you let me
something.
know. Okay. We're going to start on this side first. So again, reach back down towards your toes. You can pause about right there. I'm going to come through here. Any change? Or it feels okay?
I felt something.
More pressure into the back?
Yes.
Okay. Go ahead and stand up here for me. And then cross your arms over your chest. I'm gonna reach across you here and you're gonna lean back a bit. I'm gonna apply pressure down. Any change into the back or the knee, or it's okay. Okay. Lean towards me. Anything here?
Yeah.
If I rotate
Yeah.
you
The
first
lower
then
back.
on this left side.
Yeah.
Okay. If I do the same thing on the right side. Come towards me this way. Anything there?
Oh yeah. The same thing. The lower back.
Worse if I rotate you?
No.
No? Okay, good. All right, let me have you go ahead and have a seat on the table here for me. Let me write a couple things down because I'll tell myself I'll remember, but I won't.
Yeah, exactly. Write it down because I know I'm the same way.
Are you doing anything exciting for Easter?
I know. I'm thinking about going to church.
Well, that'll be good.
I'm not sure.
Haven't decided? That's okay.
No, because I don't like waking up in the morning.
Oh, is it an early service?
That's yeah.
Ah,
I
gotcha.
don't like that. Yeah.
Scoot back so that way your knees are flush with the table.
Okay.
I'm gonna raise you up here. I'm gonna check your reflexes and sensation in your legs, okay? I'm gonna move your foot and you just relax it.
Oh, okay.
There you go. All right, next I'm gonna check your sensation. So what I'm gonna do is I'm gonna go up and down different parts of your leg, and I need to know if it feels the same or different side to side. Okay, so I'm gonna have you close your eyes for me.
Oh.
Yep, and then you just let me know same or different. Anything there, same or different? Feels the same?
I don't feel anything.
Yep.
Just some touching.
Okay, yep, and that's what I wanna know. Does that
Oh.
feel the same, side to side?
I don't understand. What do you mean feel the same as what?
As
What am I comparing it to?
the other side. So does this side feel the same as when I touch this side?
Oh, okay. All right.
Sorry.
Sorry, yeah, sure.
Okay, and then same thing here. Do they feel the same or different?
No, this felt like you touched it more.
Okay. And then,
Same. I felt it. Okay, same. Same.
okay, you can go ahead and open your eyes there. All right, next I'm gonna check some strength. So on this side, I'm gonna have you bring your knee up like this for me. Hold here, don't let me push down. Any pain or just hard?
No, it's just hard.
Same thing on this side?
It's the pelvic here.
Pain?
Yeah.
Okay, are you able to just lift the leg up?
Oh,
Good, and come back
ooh,
down.
that hurts.
It's like almost like a cramp.
No, it's not a cramp. I
It's
feel it pain, yeah.
Okay.
That's the pelvic, right?
Yeah, so right to the, right in the
Yeah.
groin?
Yeah,
Okay.
that's the pelvic, yeah.
And is that the pain that comes and wraps around when you do it? No, that's
No,
different.
that's different. This is something else.
Okay,
Yeah, this is not normal. Meaning, like normally I didn't have this problem.
okay,
This
that's
is like a new.
the first time you felt it.
Yeah.
Okay, gotcha. On this side, don't let me push you back, so kick into me. Good, and then you pull back against me. Good, same thing here, kick into me. Good, pull back against me. Perfect.
Oh. Again.
You feel it on there? Alright, bring your toes up like this for me, don't let me push down. Good, same thing, don't let me push down. Any problem there? Okay. I'm gonna have you put your arms behind your back. I'm gonna have you slump forward like this, okay? I'm gonna move this leg. Anything in the leg, anything in the back, or just a stretch?
Just a stretch.
Okay, I'm gonna apply some pressure here and here. More of a stretch?
Ooh, yeah, more of a stretch.
If you lift just your head up, does it get better? Or is it the same?
Let me see.
Same?
Same.
Okay. I'm gonna check the same thing on the other side. Move the knee here. You feel a stretch there?
Oh yeah.
Okay, and if you lift your head up, does it change?
Okay, it's better.
It's better. Okay,
Yeah.
gotcha. Okay, you can rest your arms down.
Yes. Yeah, on the right side, I felt better when I lifted my neck up. Wow. That's interesting.
Yeah, we're testing all these things today.
Wow, that is really interesting.
All right, next I'm gonna have you do, go ahead and lay down on your back here for me. I'm gonna move your legs through some different ranges of motion. If anything changes your symptoms, whether it's back, knee, hip, or something new, you let me know.
Say something.
Okay?
Yes,
We're gonna
ma'am.
start on this side first. Just a big stretch there.
Just a big stretch.
Okay, let me know when the stretch goes away.
Went away,
Okay.
and then you feel it here, right here.
Into the groin there.
Yeah.
If I lift this foot up, anything here?
Oh, stretch, just
Or-
stretch, and this, the
If I
groin.
do this, is it worse?
No, it's better.
It's better?
Oh.
How about here?
It's now, it's painful right here.
Okay, and if you lift your head up, does it change?
Same thing.
Same, okay.
Yeah.
All right, you're gonna let this knee bend, we're gonna come up this direction. Anything
feels
into the
nice.
hip, or it feels okay?
The back, the lower back, I feel it, but it feels nice.
Like a stretch more than anything?
Yeah, yeah,
Okay.
I guess so, yeah.
How about this way? Okay,
Yeah, of course.
okay. I'm gonna apply pressure down through the hip next, okay?
Oh, the groin.
The groin, okay?
Yeah.
How about if I go this direction?
There's still the groin.
So the groin, okay?
Oh, I feel it now.
If I bring you here, anything?
Oh, no, it feels nice.
Okay, good. How about this one?
Ooh.
That lights it up.
The groin.
Okay.
It's still this, what the?
Cross this ankle over the knee.
No, it's
That's
not.
okay?
It's nice, yeah.
Okay. Alright, rest there. I'm gonna take a couple notes, okay?
Okay.
Alright. I'm gonna check the knee here next, okay? So if I bring you here, anything into the knee, are you okay?
The groin.
Just the groin there.
Ooh, oh,
Still
the
groin?
groin.
Okay.
No, when you press it down. Oh,
You
yeah.
feel that into here?
Yes.
If I turn your leg, anything
No,
there?
no groin.
Anything there?
No.
Okay.
Wow, it's a new issue now, groin. Well, I'll be coming here for years then. Paying you guys money for it. Well, it's better us than the illegals, you know?
Fine. Okay. I'm gonna do this side next too. So if I come up here, just a hamstring stretch.
Not even.
Not even. More of a
Not
stretch there.
stretch.
Okay. Let me know when that stretch goes away.
It went away.
Okay. Does it come back?
Yes, stretch.
Is it worse?
No, it's still just stretch.
Good. And if you bring your head up, does it change?
No, still
Okay.
stretch.
Good. Let this knee bend. Anything into the hip or
Lower
back?
back.
Okay.
Just the lower back end.
And is it pain or is it that feel good like the other side?
Can you do that again?
Yeah.
Pain, a little pain.
A little pain. Okay.
Yes.
How about if I go this way?
Then it's over here.
Into the groin there?
Yeah.
Okay. I'm gonna apply pressure straight down through the hip next. Anything here?
No, it felt good.
Okay. How about here?
No, it felt good.
Good. Hip feels okay there.
It's here. No, in the
You
groin.
feel it there. Okay.
Yeah.
If I bring you in like this.
That feels nice.
Good. How about here?
Nice.
Okay. I'm gonna check the knee here.
Okay.
on your foot a little bit. Feels okay?
Yeah.
Under it all through
Yes.
here? Anything here?
No, it just feels nice.
Anything here?
I feel, no, nothing.
Not too bad, okay. I forgot to check the kneecap on this side, so I'm gonna
Yeah,
check
sure.
here.
Nothing.
That's okay. Good. Through here. That's good.
Yeah.
Okay, you write a couple more things down. Alright, next one I'm gonna check, I'm gonna have you face the wall for me. I'm gonna have you straighten out this top leg and then lift up and hold. Don't let me push down. Pain or just hard?
Right here.
Into the groin there, okay? Next one I'm gonna do, bend this knee up for me. There you go. And then I'm gonna come underneath here, let this knee bend. All right, I'm gonna start here. I'm gonna move your leg out and let me know if you feel a stretch or anything here into the hip. If you do, I'm gonna ask you to bring your chin to your chest and then your chin away from your chest, okay? And just relax here, let me move you, there you go. Stretch or anything into the hip,
No.
okay?
No.
Still okay?
Go the lower back, but to the right side.
Okay.
Lower back, for some reason.
Bring your chin to your chest, does it change?
No.
And if you look up away, does it change?
No.
Okay, relax there. And go ahead and flip onto the other side for me. Alright, we're gonna do the same thing on this side. Alright, let's just straighten this leg here. Hold here, don't let me push down. Does it feel a little easier on this side?
Yeah.
Okay, and then bend this bottom knee in for me. Good.
Oh, I felt,
You feel it there?
yeah, the,
Okay, let this
Oh.
knee bend. Good, and just relax the leg here. I'm gonna bring you through here. Just relax this top
Oh,
leg.
sorry.
There you go. Anything into the hip,
the lower back,
the low
the
back,
left, but the left lower
the
back.
left lower back. And if you bring your chin to your chest, anything there?
Same,
And then away.
same,
Okay, gotcha.
the lower back only.
Okay, alright. Can you tolerate laying on your tummy?
Yeah.
Okay, I can move this so that way you can rest your face in the cradle for me. Same thing here, I'm gonna check, I'm gonna lift the legs and I'm gonna see whether you feel it into the hip, into the back, down the leg, anything there, you let me know, okay?
See, a man did this, designed this. Because where's the whole?
Do you want a pillow for your
Yeah.
chest? Okay,
Not for the chest, for the head.
for the head, okay, there you go. Whatever's comfortable for you. I get it, girl, I get it. Alright, 4 minus. Okay, we're gonna start on this side. So I'm gonna have you bend this knee, I'm gonna come up underneath it. And then I'm just gonna lift. Anything into the back or hip?
Yeah, the lower back.
Low back. If I hold the glutes here, still the low back or more the hip?
The lower back.
Low back.
But wait, you're right. Okay, what is this?
So this is gonna be low back on that
Okay,
side.
lower back.
That's where you feel it on the left side?
Yes. on the
Not
left-
here.
No, on the
Okay.
left side.
Okay, gotcha. And then if I hold the hip here, anything there?
Stretches and lower back.
Stretch into here?
Yes.
Or
and
just on
lower
that
back.
left side? Okay.
Right here.
Alright, I'm gonna come to the top here. I'm just gonna bring the knee in and out.
Nothing.
Okay, good. Relax there. Alright, same thing on this side. I'm gonna come up underneath the knee. Anything here?
Yeah, the lower back.
And is it the right side?
No, the left side.
It's just the left
Yeah,
side.
over there, yeah.
If I hold the glute,
Less pain from the lower back.
okay, good. And then if I hold here,
No pain.
no pain, great. Then I come here, in and out.
Nothing.
Good. Let me write a couple more things down real quick. here, I'm gonna apply some pressure to different segments of the back. If it feels like more than pressure, you let me know.
Okay.
Okay, I'm gonna come to either side of your rib cage here first. And we're gonna start here. Feel your discomfort?
You know, just pressure.
Just pressure. Okay. Anything here?
No, but I feel like it's going, this, like a line going.
Down the left side?
Yes.
Okay. How about here?
No,
More?
just pressure.
Just pressure? Okay.
Yeah.
What do you feel there?
They're going here.
Goes down?
Yeah.
Okay.
Okay.
Same thing here?
No.
Okay.
No.
I'm gonna come to the top of your sacrum here.
Yeah, nothing.
Anything there? And then anything to the tailbone?
No, nothing.
Okay, I'm gonna go side to side here next, okay?
Ew. That was just painful, that's all.
Like tender?
Yeah.
Okay. Same thing there?
Yeah. Nothing. It's just going to the left side.
It just goes forward. Okay.
Yeah.
Same thing on this side. Anything down or?
No.
No? Okay. Alrighty, and then I'm just gonna assess glute tissue also while I'm here, okay?
Yes.
Tender at all through here?
Just tender, yeah.
Worse on this side?
Woo!
I
Yeah.
like that. I like that. Okay. Gotcha. I'm not gonna poke it anymore. Let me have you go ahead and sit up there for me.
So obviously
No.
something's up with the left side then.
Yeah, the left side's definitely more irritable than the right side for
Yeah.
sure. So 1, 3.
That was actually ticklish to her, right? I'm glad you're a woman.
Oh goodness, that's funny. I know I've got one side too that I'm like, ooh, that side's a little more
Mhm.
tender than the other side.
Alright.
Alrighty. So the good thing is, as far as the knee goes, your knee range, I wasn't really able to reproduce any symptoms on the knee. You've got some tenderness right at the top of the tendon, which if you compensated walking because of the knee, or if you compensated walking, it's hard to say, did the kneeling cause the knee, or did the back pain and kind of compensated gait from that cause some of the knee pain? So that's a good thing. The knee isn't stuck, it's not
Good,
hypomobile, the mobility
Very
looks
good.
the same side to side. As far as the back goes, you've got a couple different things going on. So what we call adverse neural dynamics, which basically just means that we have nerves that run from our back all the way down our legs. And over time, whether it's inflammation, whether it's tight muscles, whether it's decreased joint space in the back, it doesn't give the nerve enough blood flow, space, and movement, and that's what nerves thrive on. So that's where you're getting some of that symptom that comes around the front of the thigh through there. So when I tested your legs and I had you come up and down, and I had you move your head, I was testing the neural chain to see, can I increase the tension on the nerve and then decrease the tension on the nerve and see if that changes your symptoms, which it did. So it tells me there's some neural involvement, but the good thing of the neural involvement is your reflexes are normal, you don't have significant loss of strength going down your legs or anything like that. So that's all a positive.
I know that, yeah.
You've got some stiffness in the lower back, which again has probably been ongoing for a little while. So I think if we can just work on some mobility things like that and just work on turning your core on. One of the biggest things we're going to do is just overloading the core and the glutes, so that way it better supports the rest of the chain. So as we do that and we strengthen the core, we strengthen the legs, you're gonna help the knees.
How are you gonna straighten it? I need to lose this.
Well, and just being able to turn the muscles on around the core will help
Yes.
significantly.
Good.
And that should help decrease risk of re-injuring the knee or something like that down the line too, because oftentimes whenever we have knee pain, it comes from up the chain. So I think we're gonna get a 2-for-1, kind of knock it out together with this
Now
one.
what about this though? The sciatica, that's something.
So that's the nerve. That's the nerve
that's
that's
the nerve.
going on. So I'm going to give you some different things to start working on as far as some strengthening to start turning on the muscles.
Sure.
And then I'm going to give you some nerve glides to start doing to try to help see if the nerves can start moving a little bit better.
Okay.
So whether you're sleeping or when you're walking, standing, if it turns on and it's bugging you and you get that sharp stabbing pain, can we do some movements, or can I teach you some movements so that way it gives the
Yes.
nerve a little bit more space?
Of course.
Okay. So some things I'm gonna have you start working on at home. Since you're already sitting, I'll show you the sitting one. So you can do this sitting in a chair, you can do it laying down. I'll show you both ways, and I'll print you pictures. Scoot back just a smidge for me. I'm gonna raise the table. What I'm gonna have you do, you're going to point your toe on the left side. There you go. You're gonna straighten your leg, then you're gonna flex your foot and bend your knee. Okay, you're gonna point the toe, straighten the leg, flex the foot, and bend the knee. So what we're doing here is it's called gliding or flossing the nerve. And we're trying to give the nerve more excursion and more space and blood flow, so that way you don't get those pins and needles, that tingling, that sharp shooting pain down it, and it starts to get the nerve to move a little bit more, okay? So you can do this on both sides, and I would say you can do it like sets of 10 throughout the day and just kind of see how the body responds to that, especially if like you're standing or it's bothersome after doing dishes or something like that.
And wash and laying down?
And then laying down, how it's gonna look. You're going to, can you grab behind your left thigh and hold
like
with
this.
and hold with both hands?
Wait, oops.
Are you cramping?
Yeah, okay.
Let's try
What
it.
do you mean, well, yeah, no, I can't because of my boobs.
Okay, let me get you a towel. We're gonna modify.
Okay,
We've got solutions.
okay.
All right, so you can use a towel, and what you're gonna do is you're gonna hold it.
Oh, there we go, okay.
There you
I
go.
can do this.
So same thing, you're gonna point the toe and then straighten the foot. Nope, point first, point and straighten,
Straight.
flex and bend.
Oh, bend?
The knee, yep, point the toe, straighten the knee, flex the foot, bend the knee. There you go, so it's just that nice soft fluid movement.
Yeah. Oh, this area.
You feel it moving a little bit?
Everything.
Okay. If it's too much, don't.
No, it's not too much, just do, I need to do it.
It's something, okay.
Yeah.
If it increases your symptoms or it's painful, I don't want you to push through it, so maybe just do 10 of them and then pause and take a break.
yeah.
But it should just alleviate your symptoms more than
Okay,
anything.
so I'll do that with a
With the towel, and I'll add the towel for your pictures too.
Okay.
Let me have you bend both knees up a little bit more. Feet are gonna be hip width apart, perfect. I want you to think if somebody's gonna drop something on your tummy, you're gonna pull your tummy in just a little bit, but I want you to not hold your breath. Okay, so try to breathe normally. And then I want you to lift your bottom up off the table. Good, you're gonna hold for about 3 seconds and then come back down. Does that feel okay?
Yeah, I
Okay.
feel the pain, but doesn't matter. I can
Okay.
do it.
With this, if it's painful, don't lift quite as high.
Oh, okay.
Okay.
It's not that painful. I mean, come on.
Okay,
That's military.
I get it, yeah.
Through the pain.
You just push through. So try not to do too much because we know it's been ongoing for some time. So goal of everything is to get things to calm down.
So how many should I do?
You'll do sets of 10.
Okay.
Okay, and I'll write it all the dosing and everything down. Okay, don't forget each time come back down, re-engage the tummy. Good. Then lift your bottom, hold 2, 3, then come back down, and don't forget to breathe. Okay, I know it. I get you. I do the same thing. All right. The last thing I'm gonna have you do: roll on your side facing me. All right. Your knees are gonna be bent and your feet are gonna stay together. You're just gonna lift this top knee. Yep, and then come back down. Okay. So you should feel these muscles in the hips start to work pretty quick with this one.
Ooh, now if I open it more, that's when I feel it.
The pain. Okay. So don't open too far. So rule of thumb with this one, you don't want your hip to drop back. Okay. So hips stay stacked here to about right there. And you should. Yeah. There's the muscle.
Okay.
Alrighty. All right, so we're gonna do those 3, and I'll give you pictures of them so that way you have them, okay? I think if we can get you in here twice a week to start off, kind of get symptoms to calm down if it's doable.
Yeah, but I can only come Mondays and Fridays.
Mondays and
Those are
Fridays.
the 2 days I'm off.
Okay, gotcha. We can take a peek at the schedule and see when I can bring you in.
And nothing in the morning.
Nothing in
please.
the morning,
Nothing in the morning. I'm not a morning person.
Okay, so afternoons are preferred?
Yes.
Okay.
Or late after, whatever.
Sessions will usually be 45 minutes to an hour. We'll warm up and then I'll work on you a little bit, so see if we can get some things to calm down, and then we're gonna follow up with a lot of just turning those core muscles on and going from there, okay? Any questions for me, anything you're not sure about?
You have done a really good job. You
Well,
explained everything.
Perfect.
Thank you.
I'm gonna have you fill out a survey before you go that just asks how hard things are because of the back, and then there's a survey for feedback, and before you leave, I'll get you scheduled, okay?
Okay.
All right, give me a couple minutes and we'll get you going.
Okay, thank you so much.
Thank